and welcome to the Business Spotlight. I'm Pat Dewar, and I'm so excited to have you here today to introduce you to a good friend of mine and a chiropractor, Dr. Spencer Shanley, in the Keller area that I've been using, and I encourage you as well. Dr. Spencer Shanley, so tell me, how'd you get into this business?
Well, when I was younger, I was really interested in lifting weights, working out. I was an employee at a restaurant waiting tables. And I was also interested in physical therapy when I was younger. And I didn't know where I was going to go in the future. As a young boy, you have so many options. You don't know what you're going to do. And so as I was going around and I was following a physical therapist, I really liked that a lot. And I saw myself leaning more towards that instead of owning a business. And I came across chiropractic one day. The chiropractor said that he does physical therapy, he owns his own business, he works with people, and he does personal training and all the things that I wanted to do.
Right.
So that was an eye-opener for me. I said, this is perfect. I don't have to choose anymore. This is exactly what I need to be. I need to be a chiropractor. Not to mention, when I was 19, I was in a severe car wreck. And I didn't know about chiropractic at that time. And if I had, it just something that was passed along, I didn't have the information of what they did. Years passed, and I woke up one morning and I had severe jaw pain. I couldn't move my mouth. My mom took me to the dentist because it was a jaw issue.
Sure, you'd think.
Yeah, and the dentist said that I was grinding my teeth while I was sleeping, that I would need a mouth guard for 3 or 4 months, and it might work. We didn't like the idea because it was $500. It might work, it might not. And so she decided to take me to a chiropractor. The chiropractor felt my neck and immediately told me it was my upper neck on the right side causing my jaw problem. The nerve in my neck was pinched and it was affecting my mouth. And that's why I was having that issue with not being able to open my mouth for 3 weeks. He immediately adjusted my neck, and within seconds, 50% of my severe pain was gone. And as a young person, you say, oh, it's 50% better, but it's still not perfect. It's still there, 50%. Looking back, that's amazing.
Right.
But it did make a difference, and within 12 hours, my jaw problem was gone. The pain was gone. I was able to use my mouth again. And I said, there's something to this chiropractic. So throughout my life, with all the interests of who I wanted to be, with my experience with being adjusted, it was definitely the path for me.
Excellent. That's really good. So when I think about the Keller area, you have your practice out in the Keller area, and typically this type of venue tells your story, but the people that are attracted to you are within the Dallas-Fort Worth area mostly, correct?
Correct.
And what are some of the, when I think about your industry, what's probably one of the most dramatic things you've seen in the way of improvements that you've been able to make?
Well, our number one success is decreasing migraines and headaches. So when people are suffering for years with headaches, they're taking Advil, Tylenol, of course, the things that even I take from time to time when I'm having a headache.
Sure.
But there's the cause of the headache that's not being addressed. So as a chiropractor, I address the cause to fix the problem. We adjust the patient, and that decreases about 80 to 90% of headaches on a regular occasion. So our number one success in our clinic is decreasing headaches. The second one is low back pain. Of course, a lot of people have low back pain. It's actually the number one problem out there right now is low back pain out of all the spinal areas. So we have seen miracles, or not say miracles, but amazing things that have happened in our clinic where people are barely walking into our office and they are able to walk out perfectly fine with no pain after one treatment.
Wow. And that's probably not the norm, though, one treatment.
No.
More like usually people will come in and go through a sequence with you. Wouldn't you agree?
They usually do about 12 to 24 visits depending on their issue. A consultation, examination, thorough x-rays, and then a report of findings will differentiate what the patient needs. And after we talk on their second visit, we discuss this is what's happening and why, and how we can address that issue. So yeah, number one, the visit for one treatment is usually not going to cure a problem, but sometimes that does happen.
Well, I know I mean, I've seen it with my own wife and the things that you've been able to do with her and adjusting her. And I will tell you, folks, this is something that is for real. Chiropractic medicine's been around for a lot longer than most of us knew, which surprised me. And one of the things that we want to do today is introduce somebody that's in the local area that's making a difference, most specifically in the scoliosis realm. And we'll show you more about exactly what's going on there and how you can make a real difference working with a chiropractor in your area like Dr. Spencer Shanley. And one last thing I want to make sure is people can get a hold of you at what's your number and
Well, our number for the Keller area in Dallas and Fort Worth is 817-605-9500.
Okay, so they've got that on the screen, and this is one of the things that we want to make sure that you know is that you've got a way to get a hold of Dr. Shanley. You can also visit him on his Facebook page and like it so that you can get updates on things that he's doing to make a difference in the community and in the Dallas-Fort Worth area. I've been really pleased and I'm thankful for not only knowing him but also being a part of what he's doing. So hang around. We'll be right back after we hear from our sponsors.